initial involvement with the Brevard County point in time count was back in 2008 when I served as a volunteer. The continuum of care at the time was under the direction of the Housing and Human Services for the county. I participated as a volunteer until 2011 when I began staffing the coalition from a contract between the county and United Way of Brevard. From 2011 up through 2016, I then managed the point in time count process for the Continuum of Care Coalition. The point in time count is a count of sheltered and unsheltered people who are experiencing homelessness on a single night in each community. Counts are carried out by staff and volunteers who conduct surveys who allow people experiencing homelessness to express their specific housing status and needs. Point in time counts are a critical source of data on the number and characteristic of people who are homeless in the United States. This data is used to measure homelessness on a local and national level and is published nationally on HUD Exchange website, which can be viewed by COCs and the public. PIT count data is also provided annually to Congress as part of the annual Homeless Assessment Report, otherwise called AHAR. The AHAR is used by Congress, HUD, and other departments and the public to understand the nature and extent of homelessness. HUD's point-in-time count data has become increasingly important as a measure of our local and national progress related to preventing and ending homelessness, especially with relation to our progress towards meeting the goals of Opening Doors' federal strategic plan to prevent and end homelessness. Therefore, it has become necessary to ask for more detailed information and to ensure that the data submitted to HUD is complete and accurate as practicable. Point-in-time count data and COC efforts to produce an accurate count also play a critical role in the annual COC program competition. HUD requires COCs to submit point-in-time count data and information on the methodology used to generate their sheltered and unsheltered counts. HUD uses this information to ensure that the data are valid and reliable, and then to evaluate the progress COCs are making on reducing homelessness generally and among specific populations. Collecting valid and reliable data and making progress on reducing homelessness are scoring factors in HUD's COC program competition and can influence COC program funding awards. In addition to informing national priorities and HUD funding decisions, point-in-time count data is an extremely important source for local program and system planning. To be responsible for the needs of people experiencing homelessness in the community, COCs need to understand how many individuals and families are being served by their homeless services system, as well as how many are unsheltered and might still need access to services. Current and accurate data on the number and characteristics of homeless people in the community are useful for policy and planning decisions and enable COCs to adjust the types of services available according to need, resulting in a more efficient use of limited resources. Having reliable local data on homelessness can also play a critical role in raising public awareness of the challenges facing people who are homeless and bolster efforts to garner additional public and private support. HUD requires that official point-in-time counts occur annually, more specifically during the last 10 days of January. Local communities may elect smaller counts at different times of the year or for specific populations. The U.S. Department of Housing and Urban Development, otherwise known as HUD, requires all continuum of care organizations throughout the United States to conduct a point-in-time count. The Brevard Continuum of Care, also known now as the Brevard Homeless Coalition, is responsible for the point-in-time count in the county. In the past, they collaborated with 211 Brevard, who served as the Homeless Management Information System lead. The Brevard Homeless Coalition now serves as the lead for HMIS as well. The Brevard Homeless Coalition coordinates the annual point-in-time count with local service providers and volunteers throughout the Continuum of Care network. It's important that organizations and partners in an area work together to complete the count. It is vital that every county is engaged in the point-in-time count so that the COC establishes the most accurate point-in-time count it can. To reduce and eventually eliminate homelessness, communities need to understand how many people need housing. A head count provides an easy to understand data point that helps communities determine an actionable plan. The year-over-year point-in-time count can also help communities assess their own success and know if housing programs and other forms of support are working to reduce and eliminate homelessness. This helps the public be aware of the scope of need among those experiencing homelessness. In Brevard County, we were able to reduce homelessness by 52% between 2011 and 2016 after introducing the Housing First model to the continuum. These counts help agencies at the local level for real needs. Reaching out to people who are experiencing homelessness can be difficult because they move frequently and don't always feel comfortable using community services available to them. Physically counting people in shelters and through street level surveying is a vital way to understand the scope of work a community needs to house everyone. Our Performance Measures Committee met regularly to update priorities based on the results of each count. Point-in-time counts demonstrate real needs to funding entities like HUD and other agencies because they make funding decisions based on that data. For example, during the annual COC consolidated application, this information is used by HUD to determine how much funding the COC needs to address homelessness in their area. Publishing data from a point-in-time count raises awareness among community partners who can participate in real solutions around reducing and ending homelessness. Some individuals and agencies state that the point-in-time counts are not accurate. They say that because you cannot contact and interview every single homeless individual in the area. Some of the agencies also use high numbers of homeless to promote increased funding for their programs. In response to those arguments, the point-in-time count provides a percentage of homeless that you can track from year to year, providing a scientific method of measuring success. Also, the agencies that use those higher and usually very inaccurate numbers are focused on serving the agency rather than on the homeless individuals. The point-in-time count also serves as a key outreach opportunity to provide resources to individuals experiencing homelessness, especially given the cold weather at the time of the count. The COC consolidated application is an annual funding application that is submitted as a single application with project-level priority listing for COC funding during the COC program competition. In Brevard County, what we did was we created gift bags with essentials like bus passes, socks, underwear, soap, etc., to hand out to the homeless individuals who are willing to complete the interview. Point-in-time counts are conducted in January. The data is submitted to HUD in May, and the results are published in July or August. Brevard County Homeless Coalition plans the count over many months and determines the methodology on conducting the count, including who's included in the count, how many agencies or what agencies participate, and how to engage and prepare the community in the count. The plan is then accepted by the continuum of care. Documenting sheltered people primarily involves pulling data from individual shelters on a single night. This data is pulled from HMIS as well as through volunteers conducting the survey with clients. Documenting unsheltered people requires street-level contact from a group of trained volunteers who can treat people experiencing homelessness with dignity and respect and who can explain the project quickly and concisely. This count requires volunteers to canvass the streets and known camps and other congregating places in a community. In Brevard County, we set up staging areas in North Central and South Brevard County. During the morning of the count, we provided the routes and the gift bags to each of the volunteer teams. The Brevard Homeless Coalition was trying to count youth and young adults who do not fully meet the definition of homelessness as set by HUD. If an individual does not sleep in a place not meant for human habitation, an emergency shelter, a transitional housing site, or a safe haven, and is between the ages of 14 and 24, volunteers will ask supplemental questions about their experience with housing stability. This information should be collated separately from the point-in-time count to maintain the integrity of the required PIT count methodology. The reason why children in transition who are couch surfers at friends' and relatives' homes were counted was due to the ability to use those higher nums to increase funding for their programs. Again, this is another case of putting the agency or the program itself over the needs and the benefits of the homeless individuals. The point-in-time count is not the only data on individuals experiencing homelessness being collected by Brevard Homeless Coalition and reported to HUD. There are three other reports that provide insight into the status of homelessness. First is the longitudinal systems analysis produced from a COC's HMIS, provides HUD and the COC with critical information about how people are experiencing homelessness and navigate the homelessness response system of care over the annual reporting year. The housing inventory count, HIC. The COC is also required to conduct an annual housing inventory count, documenting the residential resources in communities throughout the COC dedicated to assisting people experiencing homelessness. And the System Performance Measure, a provision of the McKinney-Vento Homeless Assistance Act, requires that communities measure their performance as a coordinated system in addition to analyzing performance by specific projects or project types. Now I'd like to discuss how to manage a point-in-time count. First thing you do is establish a primary point-in-time count coordinator and committee. That is a subcommittee of the continuum of care, usually done early in the year after the point-in-time count that you've previously done. Then you establish your subcommittees focused on specific areas of the count that could include but not limited to methodology, data analysis and reporting, domestic violence and sexual assault survivors, people who have experienced homelessness, homeless veterans, unsheltered populations, volunteers, homeless youth, students and families, media and public relations, and government relations. Next, select your point-in-time count date and time. Select a date for the point-in-time count between January 22nd and January 31st, and clearly identify which night will serve as the night of the count. Select a single night for the point-in-time count and housing inventory count. The days of the count. If using a night of the count method, what hours will the unsheltered count occur? In terms of the night of the count, since it's end of January in Florida, in Brevard County, Florida, end of January or sometime in January, use of the coldest nights of the years. So as a result of that, sometimes the count falls on what we call a cold night, when the cold night shelters are open, and that makes it much easier to connect with and interview homeless individuals. So the fourth thing is determine your methodology. Review HUD guidance to determine the most appropriate methods for conducting your shelter and unsheltered counts in the COC. Final point-in-time count methodology must be approved by the COC in accordance to their governance charter. And considerations, you may want to define and describe the geographic area that the COC covers. In Brevard County, it was the county. Identify which consolidated plan jurisdictions fall within the COC's geographic area. Identify specific geographic areas that must be included in the point-in-time count: cities, towns, counties, districts, neighborhoods. Assess the number of resources available in the COC to count and survey all unsheltered people on the night of the count. Examine data from the Homeless Management Information System participating projects to determine if coverage, completeness are sufficient for deriving the sheltered point-in-time count. Use more of the following approaches: complete census count, random sample and extrapolation, non-random sample and extrapolation, combination approach. Night of the count, beneficial, like I said, when we have cold night shelters. Complete the coverage count, known locations for the count, random samples of areas counted, service-based count, combination approach. Fifth, the COC board approves the point-in-time count data and methodological approach. Number 6, review the HIC and PIT count annual notice. 7, identify and confirm all shelter count locations. Create a list of emergency shelters, safe havens, and transitional housing projects in the COC as identified in the previous housing inventory count. Add any new projects that were not included in the previous year's HIC. Determine which shelter count locations will use HMIS for their shelter count and which will use paper surveys. Number Number 8, identify and confirm unsheltered count locations. Identify and map the specific geographic areas to be included in the unsheltered count based on the unsheltered methodology. That is by name, list of places, street intersections, bridges, abandoned buildings, campsites, etc. Then is the point in time count planning worksheet. Identify and list the geographic areas to be excluded from the unsheltered count if applicable. To get the most accurate count possible, I use the emergency management maps to provide the greatest coverage of the entire county. During training, I explained that some areas may not have any or just a small number of homeless counted, while others will have a much larger amount identified. I did this to counter the arguments that there are way more homeless that was counted by the point in time count. Number 10, develop surveys. At a minimum, include all information required by HUD as published in its current notice for housing inventory count and point in time count data collection for Continuum of Care program and Emergency Solution Grants program after HUD has issued updated data collection guidance. Decide if additional information beyond what is required by HUD will be collected based on the needs of the COC. Determine a consistent methodology in which surveys will be administered for sheltered and unsheltered populations, including privacy and safety of participants and survey administrators. We always send out our teams of volunteers in groups of 2 or more, with new volunteers always matched up with veteran volunteers. Test the survey instrument with people experiencing homelessness and volunteers to check the comprehension and consistency. It's advisable to include someone experiencing homelessness on the planning committee. Number 11, develop volunteer recruitment and a deployment plan. List of volunteer roles and number of volunteers for each role needed to execute the point in time count, and describe how the volunteers will be recruited. Second, describe volunteer logistics and deployment on the night of the count. Designate staging areas. We set up our staging areas at the COC member agencies in North Central and South Brevard. Leaders were identified from the member COC agencies, usually the one that we were using as a staging area. The command center would be the Brevard Homeless Coalition office, and communication plan would include check-in times for volunteers at each staging area. The volunteers would leave their cell phone numbers with the staging area commander. If no contact was made, they would reach out to them. Secure incentives to provide homeless people who participate in the PIT count, if applicable. If people experiencing homelessness or who are formerly homeless will be participating as volunteers, determine if stipends or other incentives will be provided and policies for administering them. We provided gift cards for participating homeless individuals who assisted in providing the surveys. 13, set training dates. List training dates and times for specialized groups or general volunteers training. I scheduled 4 training dates, 1 for each part of Brevard County and 1 for the weekend for people who could not miss work during the week. Develop training based on the point in time count methodologies and volunteer roles. Assign geographic areas to teams of interviewers. Clearly mark boundaries of neighboring COCs. We identified the streets that serve as boundaries between the north, central, and south parts of Brevard County. Then what we did was we set sock drive packing dates. We set the dates for the sock drive items to be dropped off at the point in time count staging areas. We called it a sock drive, but also included other items that homeless may need in the community. We list the sock drive packing dates and times for corporate groups or general volunteer training. I schedule 4 packing dates, 1 for each part of the county, 1 for the weekend for people who could not miss work, and then deliver the sorted and packed sock drive bags to each point in time count staging areas for the volunteers to pick up and distribute on the day of the count. Number 15, publicize the count. Describe communication strategies for conducting the count and announcing the results of the count. Designated phone number, listserv, emails, press release, etc. Designate the list spokesperson, liaison for media, consolidated plan jurisdiction, COC members, people experiencing homelessness if special events are being held, community stakeholder groups such as hospitals, mental health providers, advocacy organizations, etc. Conduct volunteer interviewer trainings. As in the general training, I schedule 4 training days, one for each part of the county, one on the weekend for people who could not miss work. Conduct the point in time count sometime during the last 10 calendar days in January. The shelter count, if HMIS has sufficient coverage and completeness, generate the point in time count from HMIS. If point in time count is conducted using HMIS, hold a meeting in advance with the HMIS administrator to ensure the plan is in place. For shelters that do not input complete data into HMIS or domestic violence providers, administer project and or client surveys to obtain the required information. Provide due date for providers to submit the data to COC using the method identified. Deploy interviewers to shelters using paper surveys if requested by providers. For the unsheltered count, deploy interviewers to designated geographic areas using the guidance provided in the volunteer interview training. During the count, check in to ensure that the areas have adequate coverage and assign additional interviewers as needed. Number 18, collect the completed surveys from interviewers using the method identified by the COC. Then review surveys for data quality and organizing them to prepare for data entry. Code surveys, if using statistical analysis software, enter data into statistical analysis software or database. Find and correct data entry or data collection errors. Securely store and or dispose of sheltered and unsheltered surveys. Find and remove duplicate records that relate to the same person in the PIT count using one or more of the 3 identified methods. Analyze the data to determine the PIT count for sheltered and unsheltered populations. Ensure that the HIC and the PIT sheltered count are identical. Share data results with the PIT committee, the COC board, and members. Submit the point in time count and the HIC data through HUD's HDX. Use information from the PIT count to assist people experiencing homelessness through advanced outreach and triaging efforts and adapting the COC's resources to meet the needs of certain populations. Release PIT count data to the community using formal, media, and informal means. Provide feedback to volunteers and appreciation for their efforts. And then hold the PIT count debrief meeting with PIT coordinators and leaders. Changes for next year's point in time count, note successes and areas for improvement for the following year, and then start the whole process all over again.